Now let's talk about phlegm heat obstructing the lung. Phlegm heat in the lung will often have developed from other lung imbalances. Damp phlegm in the lung can easily transform into phlegm heat in the lung because either there is already heat in the lung or the stagnation that is created by the phlegm will generate heat in the lung. The difference between this pattern and damp phlegm in the lung is that there are heat symptoms and signs. The pattern of lung heat can also be a precursor of this because heat in the lung can condense fluids and thereby lead to the formation of phlegm heat. It is important to note that phlegm heat does not necessarily manifest with yellow or green sputum. The sputum can be white, thick, and sticky. This is due to the heat condensing fluids so that they become thick and sticky. When the phlegm is yellow or greenish, the heat will be more intense. Concept, this is due to phlegm combined with heat obstructing the lung, which leads to impairment in dispersing and descending functions, and consequently manifests as excess heat along the lung channel. Key symptoms, cough with profuse sputum and symptoms of interior excess heat. Clinical manifestations are cough with profuse yellow thick sputum, chest stuffiness, dyspnea, nostrils flaring, gurgling sound in the throat, vexation and restlessness, fever, thirst, cough, and expectoration with foul smelling, pus-like sputum with blood, chest pain, constipation, scanty dark urine, red tongue with yellow greasy coating, a slippery and rapid pulse. This pattern is mainly caused by pathogens invading the lung and then stagnating and subsequently turning into heat, which injures lung fluids to form phlegm. Alternatively, it can be caused by long-standing phlegm turning into heat, both of which combine together and obstruct the lung. Phlegm heat in the lung can arise if there is an excessive consumption of foods that create phlegm or heat. Examples of these foods are dairy products, sweet, sugar, alcohol, wheat, fried food, too much red meat, spicy food, and chocolate. Very cold food and beverages or raw vegetables can be involved indirectly because they can weaken spleen yang and qi, thereby leading to the creation of dampness and phlegm. Invasions of exogenous pathogenic qi can create both phlegm and heat in the lung. Air pollution, especially tobacco smoke, can be an important etiological factor. This is seen in many people who smoke tobacco developing a smoker's cough, having difficulty breathing and easily becoming breathless. Stress can create heat in the body, and emotions such as anger, irritation, and frustration can generate heat in the liver that then rises to the lung and creates heat here. So the etiology of phlegm heat obstructing the lung is invasion of exterior heat, depressed in the lung, and transforming into heat. Internally produced heat from yin deficiency or qi stagnation, from long-term emotional strain, excessive consumption of greasy and cold raw foods. Possible presenting condition would be bronchial asthma, acute bronchitis, pneumonia, pulmonary emphysema with infection. Signs and symptoms are cough and panting, barking cough with profuse sticky yellow or green sputum, shortness of breath, sweating, flaring nostrils, expectoration of blood and or purulent phlegm with fishy smell, wheezing, feeling of oppression of the chest, feeling of heat, thirst, insomnia, agitation. Pulse, slippery, rapid. Tongue is red, swollen with a sticky yellow coating. Treatment principle, clear and drain phlegm heat. Acupuncture treatment, lung 5 to clear heat and phlegm. Lung 10 to clear lung heat. Bladder 13 to supplement lung qi. Stomach 40 to resolve phlegm. Li 4 to release the exterior. Stomach 36 to transform phlegm. Lung 7 to restore lung descending function. Li 11 to clear lung heat. Ren 12 to supplement spleen, resolve phlegm. Lung 1 to descend lung qi and alleviate cough. Ren 17 to unbind the chest, and kidney 6 to disinhibit the throat. Needle with drainage. We prick Li1 to bleed. A person with phlegm heat in the lung should avoid consuming food that creates heat, dampness, and phlegm. This includes dairy products, sweets, dried fruits, sugar, alcohol, fried food, chili, pepper, garlic, chocolate, and lung. Smoking should be discouraged, and the person should avoid other forms of air pollution.